Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the fifth video of repeat revision course of fixed partial denture, which is very important for NLE, MDS and BD as well as for BDS students. In this video we will discuss about abutment, factor influencing abutment selection and different types of abutment which are used in fixed partial denture, and also about Auntie's law, which is very important. Now this topic is helpful for your theory as well as for your clinical exam, and also for they will be helpful in wards and clinic to when treating the patient. Now first we start from abutment definition. What is abutment? Now look at this diagram. This is the abutment tooth which are used to support the processes above the abutment tooth. We make a retainer, and with retainer we connect the pontic with the help of connectors. Now abutment may be tooth or part of tooth like root, and it may be implant which support the processes, and processes may be fixed and removable. Now how we define abutment? Abutment is defined as a tooth or a portion of the tooth or that portion of an implant used for support of a fixed or removable prosthesis. This is the definition of abutment. Now come to the selection. Selection of the appropriate abutment is very crucial for the success of the fixed processes. Abutment tooth should be strong enough to bear the functional forces directed not only to them but also to be the missing teeth or tooth main pontic. There are number of criteria for selecting an appropriate abutment. Now come to the criteria for selection of abutment. It should not be mobile. It should have a good bone support. It should have a good periodontal status. It should be healthy without any inflammation. It should have adequate amount of coronal tooth structure, mean crown. It should have a favorable crown to root ratio, which is minimal. Acceptable is a 1:1, but the recommended is a 2:3, in 2 parts of crown and 3 parts of root. It should be vital tooth. If not, then an endodontically treated tooth can be selected. First, it should be vital. If tooth is not vital, it should be endodontically treated. Now come to the factor influencing abutment selection. These are the 5 factors which influencing the abutment selection, and we will study one by one in detail. The first one is the crown to root ratio. Second is the root configuration. Third is the location, angulation and condition of the abutment. Fourth is the root surface area, and fifth is the rigidity of fixed partial denture. Now come to the first is the crown to root ratio. This is the crown to root ratio. It should be, the recommended is, it should be 2 parts of crown and 3 parts of the root, but minimal is 1:1. This is the now come to the crown to root ratio. This is the ratio between the tooth which is above the alveolar crest, mean crown, and the portion of the root which is surrounded by the bone. The recommended ratio between the crown and the root is 2:3, mean 2 parts of the crown, 3 parts of the root for an ideal abutment. However, minimal ratio 1:1 may be acceptable for abutment under normal condition. In cases where the opposing occlusion consists of denture teeth or the natural teeth which are periodontally weak, crown to root ratio greater than 1:1 may be acceptable, but with caution. Longer the edentulous span, greater the torque on the abutment tooth, and more favorable should be the ratio. Multiple abutment can be sometimes compensate for poor crown to root ratio or be useful in long span fixed partial denture. If a tooth If we use tooth per as abutment and its crown to root ratio is not favorable, then with that tooth, the other tooth we should also use as a abutment. The first tooth should be, will be called primary abutment, and the second tooth, with their tooth, if we use this will be known as secondary abutment. Like if we use first premolar, but its crown to root ratio is not favorable, then with first premolar we also include the second premolar. Now come to the second factor. Second factor is the root configuration. Look at here, various root configuration of teeth. In various root configuration of teeth, first if we select as abutment, posterior tooth be good abutment as compared to the interior tooth, because due to more roots and more bone support. Now in posterior teeth, the tooth with divergent root are used as a good abutment, because they are act as a good abutment. Why? Because between this divergent root there will be bone, and the tooth with convergent root, the tooth with convergent root is not as a good abutment. Now in anterior teeth, single rooted tooth, the tooth with the straight or taper root act as a poor abutment, but the tooth with the diverged root will act as a good abutment. Now with root configuration, this factor determines the suitability of the prospective abutment tooth. Multi-rooted posterior tooth provide better support than the single-rooted anterior teeth. Posterior teeth have a broader occlusal table and better bone support than the anterior teeth. Multi-rooted teeth with divergent root are advantageous than the teeth with a convergent or fused root. Likewise, a single-rooted tooth with a curved root or irregular configuration is preferable to a single-rooted tooth with a tapered root. The third factor is the location, angulation, and condition of abutment. Now come to the condition of abutment. Healthy abutment tooth is always more preferred to periodontally compromised or mobile tooth. Next is the location of the prospective abutment. This is an important factor as the configuration and the design of fixed processes can be planned accordingly. Narrow dental arch will be subjected to greater leverage forces than wider arch. This is important. Next come to the angulation of the abutment. J.M. Reynolds in 1968 has suggested that the tooth should be not inclined more than 25 to 30 degree. It should be parallel. It should be straight, not inclined. It should be not tilted. More than 25 to 30, as the tooth is in best position to bear the vertically directed forces along the long axis of the tooth. If the tooth is severely inclined, the harmful torquing forces will be distributed to the tooth. Mesially tilted or distally tilted tooth required modification in tooth preparation. This situation can be demand more tooth reduction, or even if there is a chances of the pulp exposure, it should required endodontic treatment. Next is the root. The fourth factor is the root surface area. It is also called the perisegmental area of the abutment tooth. This is another important consideration. Larger is the tooth, more the root surface is available and better. It is to be bear the functional process. Antilla is followed as a clinical guideline to select an appropriate tooth. And in the root surface area, the antilla is very, very important. For example, this is the antilla. Look at the figure 23.3. What antilla says? Here we replace a first molar tooth, which is the missing tooth, Here we replace by pontic, and first premolar and second molar we use as an abutment, and their tooth we give a retainer. Now, what Antilla says, the combined width of root of a first premolar and second molar, the combined width of root of these two teeth should be equal to the width of the first molar which we are replacing, or should be greater in order to support that tooth. This is the antilla. Antilla, look at that figure 23.3. Antilla, the combined perisegmental area of a second premolar and second molar should be greater or equal to the first molar. Now come to the antilla. IHNT in 1926 stated that the abutment teeth should have a combined perisegmental area equal or greater than the tooth or teeth to be replaced. This statement was referred by J.F. Johnson in 1971 as a Ant's law. Now come to the importance of Ant's law. Ant's law help in evaluating the perisegmental area of the abutment teeth. Larger tooth with greater surface area bear the functional forces better than the smaller tooth with lesser surface area. The root surface area of maxillary and mandibular teeth have been reported by A. Gibson. The value given by Gibson may not always be relevant to the given clinical situation. In the clinical situation, the proposed abutment tooth may be reduced bone support due to periodontal reason. In such cases, the capacity to bear functional forces by this tooth may be questionable, and this should be considered while making proper diagnosis and treatment planning. Ant's law is used as a clinical guideline to plan treatment in PICS prosthodontics. The recommended crown to root ratio is 2:3, and a ratio of 1:1 is considered minimal to accept the prospective abutment per PICS partial denture. A ratio of 1:1 or more will be satisfied. Antilla, shorter span PICS partial denture has better prognosis than the long span denture. Abutment tooth should be carefully selected by giving due consideration to the location, occlusion, angulation, bone support, periodontal status. In case of bone loss due to periodontal reason, mesial or distal drifting of abutment tooth, endodontically treated tooth mobility, or unfavorable occlusion, the law can be modified by increasing the number of abutments, like primary abutment. With primary, we select another abutment. This is known as secondary abutment. Now come to the last factor which affect the abutment selection is the rigidity of PICS partial denture. Now, the lack of rigidity of the prosthesis is one of the major cause of the failure. The prosthesis should be rigid. The denture should be rigid and should have a good flexural strength to restore the masticatory forces. Flexion means bending. Flexure can have a damaging effect on the abutment, especially in cases of a long span bridges. In result, there will be bending of the prosthesis. It should be rigid. Now come to the next part, which is the different types of abutment used in PICS partial denture. The type, status and location of abutment tooth determine the type of PICS partial denture. Type of abutment commonly used in PICS prosthodontics are the number one is the unrestored or ideal abutment. Second is the pier abutment. Third is the cantilever abutment. Fourth is the tilted molar abutment. Fifth is the endodontically treated abutment, and last is the implant abutment. Now come to the detail. First is the unrestored or ideal abutment. This type of abutment is a healthy, caries-free, periodontally sound tooth with adequate clinical height. It provides best prognosis for PICS processes. Some desirable features of ideal abutment are as follows. It should be caries-free, it should have adequate bone support, it should have optimum crown to root ratio, it should be periodontically healthy, it should have sound tooth structure with adequate enamel dentin. Second is the pier abutment, and we already discussed pier abutment is that abutment on the both sides of the abutment there is a edentulous area. The abutment tooth with on the both side of the that abutment tooth will called as a pier abutment. If on the both side of the abutment there is a edentulous area, this is known as pier abutment. Pier abutment is defined as a natural tooth located between the terminal abutment, because on that abutment interior on the both side of the abutment there is a edentulous area, and on the one side there will be another abutment, and next side there will be another abutment, which is known as anterior and posterior abutment. A natural tooth located between the terminal abutment that serve to support a fixed or removable dental processes. A pier abutment is a lone standing tooth with edentulous spaces present both mesially and distally to it. In long span fixed partial denture, where support is sought for from the pier abutment and the adjacent teeth, these are chances of more stress concentration around the abutment teeth with rigid connector. And in pier abutment, then we use non-rigid connector, which is act as a stress breaker and is a key and keyway. We already discussed that abutment. And now factor which influence the amount of stress on abutment teeth are position of abutment in the arch, physiological tooth movement, and retentive capacity of the retainer. The middle abutment acts as a fulcrum, and the excessive forces transmitted to the terminal retainer cause the weaker retainer to lose. This causes marginal leakage, secondary caries, and ultimately processes failure. In such situation, non-rigid connectors are recommended, which help in transferring the stresses to the supporting bone. The commonly used non-rigid connector or stress breaking device consist of key and keyway. The stress breaking device is usually placed on the pier abutment. The keyway is placed on the distal contour of the pier abutment, and the key is placed on the mesial side of the distal pontic. Mesial movement of the posterior teeth in function result in proper setting of key into keyway. However, a non-rigid connector should be avoided in situation where the following characteristics are observed. Number one is the abutment tooth or teeth are mobile. Then we avoid non-rigid connector. Second, the posterior abutment and the pontic are opposed with an removable denture or unopposed. In such situation, the posterior teeth tend to supra-erupt, thereby unseating the key from keyway. In that condition, we should avoid the non-rigid connector. Next is the tilted molar abutment. If molar is tilted, then how we select the tilted molar if we use as an abutment? Molar teeth posterior to the edentulous space tend to drift mesially into it. If the space is not restored, like first molar, they drift mesially. Tilted molar tooth, if used as an abutment, make it difficult to achieve a single path of insertion. In insertion, there will be difficulty. Fixed bridge. The situation becomes even more complex if a third molar is present next to the tilted second molar. Severely tilted tooth should be avoided. If there is severely tilted, we should not be used as an abutment. If it is used as an abutment, however, if only single tilted tooth is present distal to edentulous space, if there is no third molar, it should be considered as an abutment. Tilted molar used as an abutment can be corrected by one of the following methods. How we correct tilted molar? By one of the following methods. Number one is the recontouring or restoration of the mesial surface of the tilted molar. If there is a slight tilt, we should restore the mesial surface to make the tooth parallel straight from both sides. Recontouring or restoring of the mesial surface of the tilted molar, this is followed in case of slight tilt. Second is the orthodontic treatment. If there is a severe tilting of the molar tooth, the treatment of choice should be orthodontic uprighting of the tilted molar tooth. This is achieved by using a fixed appliance. If third molar is, we use distally. If third molar is present next to the tilted second molar, then we should extract the third molar Then we move the tooth distally with the help of orthodontic appliance. It is best extracted to allow distal movement of the second molar. The third method is the modified partial veneer crown. We will give partial veneer crown, but it is modified. We should give only on the mesial surface to parallel that surface. Not we not give veneer on distal surface, only on mesial surface. This is the modified partial veneer crown. Mesial half crown or modified partial veneer crown should be used as a retainer on the tilted abutment tooth. The distal half of the crown is left unprepared, where the mesial half is prepared to achieve single path of insertion. Now, the fourth method is the telescopic crown. And look at it here in diagram. In telescopic crown, the tooth is tilted. In telescopic crown, first we prepare the tilted tooth and we give a crown on the tooth, which is known as telescopic coping. Then we prepare that crown parts to achieve the single path of insertion. Then on that crown above we give another crown retainer. This is known as telescopic crown. Here in figure 23.5, telescopic coping used on tilted molar to achieve favorable path of insertion. Now in telescopic crown, it is defined as an artificial crown constructed to fit over coping framework. This coping can be another crown, or a bar or any other suitable rigid support for dental processes. The tilted molar abutment is radically reduced to fabricate a coping. First we prepare the tooth and make a coping. This coping ensures good marginal adaptation. A telescopic crown is then fitted over this coping to get a favorable path of insertion. The next method for tilted molar is a non-rigid connector. This is a non-rigid connector. We give on the distal surface of premolar to compensate for inclined molar. Mean on the distal surface of the premolar we give a non-rigid connector to compensate the tilted molar. In non-rigid connector, a full veneer preparation is done for tilted molar tooth along its long axis. The mesial abutment is prepared on its distal surface to form a keyway. And fixed partial denture is fabricated to slide into this keyway. The distal abutment tilted molar is have a rigid connector, where the mesial abutment premolar is a non-rigid connector. The non-rigid design should not be indiscriminately used as a cantilevering effect, produce additional lateral stresses harmful to the abutment with good rigid connector. This method is more useful if the molar tooth is tilted both mesially and lingually. The non-rigid design is avoided in the long span bridges. Now come to the last, which is the cantilever pontic. Look at the figure 23.7. Cantilever bridge is that bridge. Normally we give retainer on both sides of the pontic, but in cantilever we use only one abutment tooth and we use only one retainer on that abutment. With a pontic on one side there is a retainer and abutment tooth, but on other side there is no abutment, no retainer. This is known as cantilever pontic. Here the cantilever pontic tend to apply leverage forces to the supporting abutment tooth. Now this is a supporting abutment and this is a cantilever pontic. In cantilever, dental processes is defined as fixed dental processes in which the pontic is cantilever. For example, is retain and support only one end by one or more abutment. Support is from one end. Look at, only support is from canine but not from incisor. If this type of design is supported only at one end, it have the potential to damage the supporting abutment tooth. The pontic of the cantilever fixed partial denture act as a lever which tend to apply harmful leverage forces to the abutment tooth. The abutment tooth or teeth supporting cantilever fixed partial denture should have the following characteristics. Mean the cantilever abutment should have the following characteristics. It is the good bone support, healthy periodontium, variable crown to root ratio, long root with sufficient height of clinical crown. Now, the uses of cantilever. Cantilever fixed partial denture can be used to replace maxillary lateral incisor, taking support from the canine, and can be used to replace mandibular first premolar, taking support from the second premolar and the first molar. The cantilever, like here, maxillary lateral incisor, we can replace by cantilever bridge and canine, because canine have a long root and good bone support. But when we replace first premolar, then when we give cantilever bridge, then we use second premolar and first molar as a abutment, because only second premolar cannot support the first premolar. Now, the cantilever pontic should not have any contact in lateral excursion and should have light occlusal contact. Posterior cantilever pontic should be made up of small size so as to avoid excessive forces on abutment. Cantilever fixed partial denture should be avoided in periodontally compromised dentition. An endodontically treated tooth is contraindicated as an abutment to a cantilever fixed partial denture as it is subjected to fracture. Why? Because in root canal treatment we remove dentine. Because of considerable loss of significant supporting dentine, however, double abutment with splint retainer can be used in such cases. This is all about abutment definition, factor influencing abutment selection, Anti's law, and different types of abutment which are used in fixed partial denture. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.